We are now recording. Hello, everybody. It's the end of the day. I hope you all had a lovely Monday. I'm Laura. I'm going to be your moderator today. If you have any questions in the meantime, drop them in the chat. I will do my best to get Dr. Cannon's attention. But for now, it's my absolute pleasure to introduce Dr. Stacy Cannon, who is currently the medical director at Metro Animal Care and Control and the Central Regional Director for ACAT. She's also a new mom. To learn more about Dr. Cannon, please check out her bio under the speaker tab. Today, she will be talking about the importance of sanitation and how it can save lives. We are so very blessed to have her in our own backyard. Dr. Cannon, the floor is yours.
Thank you. I see a wave. Thank you guys for sticking with us till the end of the day. I appreciate it. I hope I will share some really helpful information for you in your daily work. I do want to just remind everybody that after this presentation, we're going to have our general meeting for the ACAT. It's our membership meeting, so everybody is welcome to come. We really want to hear from you guys and chat about what your goals are and what you'd like for the following year. And as you might remember from the very beginning of the day, we need some new regional directors for Middle Tennessee. So if anybody has questions or wants to know more about serving on the board and you're in Middle Tennessee, or even if you're not, feel free to reach out to me. I will gladly chat with you. I would love to have you join us. Okay, so yeah, I will get started. All right, so we're going to just dive right in, and certainly this is no surprise to anyone. We see quite a few risk factors for infectious disease spread in our animal shelters. So things like crowding. Certainly we get a lot of animals coming in. Sometimes you cannot control your intake for whatever reason, so we're worried about overcrowding. Whenever we put a lot of animals together in a new environment, they're going to be stressed. Certainly there's new smells, new sights, sounds everywhere, unfamiliar people, all of those things cause stress on our animals. We might have some facility flaws. Most of us don't have brand new, wonderfully designed facilities that we're working with. So we may have older structures. Maybe things weren't designed for the types and number of animals that we're caring for, or they were designed for animals to only stay a few days and then leave. And so now we're actually experiencing some longer lengths of stay as we're treating more animals. And so those facilities are not necessarily designed for that. We definitely have vulnerable populations coming into shelters. So we'll talk some more about that, but we've got animals with unknown vaccine histories. Maybe they've never seen a veterinarian or never had a vaccination in their lives. So they are very naive to infectious disease, and they're vulnerable and at risk of contracting different diseases. We also have levels of endemic disease in our community. And so those are big risk factors as well. We'll talk some about. So we already know that we see parvovirus, panleukopenia in our community. We see ringworm, we see distemper, all these different things that are circulating out in the community. Our animals that are coming into shelters could be incubating and harboring those diseases. So they're bringing them into the facility with them. And then finally, a lack of biosecurity. So that's sometimes a big challenge for shelters and kennel environments where we're trying to protect animals because of all of these reasons. But we have this breakdown, and some of that comes back to our facility flaws, but also training of our staff and volunteers and the folks that are handling animals in our facility. So that lack of biosecurity is another risk factor for infectious disease spread. So this shelter, as you can see, you can already identify some things in this picture that are some facility flaws that might be challenging. So those are single compartment kennels. So there's no guillotine door, to be able to put the dog on the other side while you're cleaning that run. So the dog has to actually be removed from the run and handled in order to clean that out. The floor is sloped forward, so everything has to run forward to a drain in the center of the room. So that creates many opportunities for infectious disease to spread just during the sanitation process. And then also, as you can see, it's an indoor facility, so the air quality might be decreased as well because they don't have access to the outdoors. So this is a common scenario in many shelters. We've got some small puppies coming into the facility. And so whenever you see these guys, if you're walking through doing your daily rounds, I just kind of like to brainstorm and think about what comes to mind when we see these puppies. So maybe they're about 6 weeks old. They look quite healthy and robust for sure. We actually house puppies this way in the shelter when they come to us in Nashville, we give them, the mom typically has a swimming pool like that so that she can have a nice little nest to be able to curl up and nurse those puppies. So that's why they have a swimming pool. So these are certainly an example of a vulnerable population. These puppies have probably never been to a veterinarian before. They may not have been vaccinated before they come into your shelter. And they are certainly at risk of contracting infectious disease because of their age and just immature immune system, lack of previous preventive health care. The other thing I think about when I see puppies in the shelter is, could they be incubating disease, right? So a lot of times we've got animals that come into the shelter, they look healthy, but that doesn't mean that they were not recently exposed to something, and they could be harboring that, and they may break with something in the next few days while they're in your facility. Or maybe they will break with something after they leave. Perhaps if they go to rescue, or they get adopted, or they go on transport, they could be incubating disease for those few days that they were with you, and they can start shedding before they show clinical signs. So I certainly want to make sure that these puppies have been vaccinated and dewormed. That's something that I want to double check. I also want to consider their behavioral health. That's another big component. Puppies need adequate socialization, and it's hard to provide that in the shelter and also maintain their biosecurity. So whenever we're thinking about best practices for behavioral health for young juveniles, puppies and kittens, the best place for those animals is typically out of the shelter for all of these reasons, but especially for their behavioral health. They're going to be provided more socialization and proper handling in a safer environment if they're in a foster home or in an adoptive home. So our solution is to get them out of the shelter as quickly as possible. Dr. Karsten is going to give a fantastic presentation tomorrow in the operations track, I believe, about minimizing length of stay. And it plays a key role with puppies just like this, but with every animal in the shelter. So many of our risk factors can be mitigated by minimizing length of stay. So in the past, a lot of us can remember the days where we might have been taught to keep puppies in the shelter for 2 weeks so that they could get 2 vaccines. We thought that that was our best practice, to make sure that they had 2 vaccines on board for parvo before they left the shelter, basically. And what we've realized is that that is actually not the best recommendation for puppies or kittens or juveniles. So the longer that they sit with us in the shelter, the more at risk they are of being exposed to infectious disease, the more risk that we have that they could be shedding something that's going to contaminate our environment or expose other animals in the shelter. And really, those 2 vaccines may not be enough to protect them anyway, just because of the interference from their maternal antibodies. So bottom line, the best practice is to get these guys out of the shelter as quickly as possible. And that can look like a lot of different things. It might be getting them back to their owner as quickly as possible. If they get reclaimed, getting them into a foster home, getting them to a rescue partner, basically getting them out of the high-risk population shelter environment and into a low-risk, safe space. So some disease prevention strategies that we harp on in shelter medicine. Certainly proper sanitation, which is what we're going to cover this hour. Preventing crowding is the most important thing that we can do to prevent disease, because all of these things the infectious disease pressure just goes up exponentially whenever we have overcrowding in our facility. So that's just more opportunity for animals to shed infectious disease, more opportunity for us to spread it to them, and more stress. So their immune systems are going to be even further compromised when they're crowded. We're going to always recommend vaccination on intake. There's plenty of guidelines to help follow. And if you have any questions about what vaccines to use or how to know when to give them, certainly I am happy to answer those. You can always email me. Appropriate housing. This is a critical piece too. And there's a lot of things that we've learned over the past 10 years about how to appropriately house both cats and dogs in shelters, even though they need to stay for a very short period of time. So we'll talk briefly about that. And then minimizing length of stay, like I mentioned. There will be entire presentations tomorrow about housing and minimizing length of stay. So be sure to tune in for those. So our goals with sanitation in the shelter environment, we are trying to protect animal health, but we are also trying to protect human health. There are certainly some infections that are zoonotic, which means they can spread from animals to humans. And so we've got staff members that work in our shelters, we have volunteers that visit us, and we have community members, right? We have adopters, we have volunteers. Sometimes we even have, kids that are coming in. So we've got to be protecting human health as well. And then we're also trying to provide a pleasant, welcoming environment. So that means we need a clean, place that smells fresh, to be able to welcome people in. If our shelter environment, our facility doesn't, feels dirty or smells dirty to people, it's not going to be as welcoming, and we may see that negatively affect our image in the community, as well as having people actually come in and spend time there, and be able to actually help us with our mission. And then also, certainly, we want to manage our resources. So we're looking at how to achieve these goals without breaking the bank. Resources being both financial, so costs of disinfectants, cost of equipment, but also our staff time. Time is a huge resource, right? Because we all have limited staff, and there's a lot of things that they need to be doing every day. Sanitation just being very, the very basic. So a couple of definitions here, just because we use a lot of these terms interchangeably, but you guys might already know that there's a little bit of nuance here. So when we talk about cleaning versus disinfection, cleaning is the removal of the visible organic material and dirt on a surface. And we use detergents to do that. We use physical methods like washing our hands, elbow grease, as a lot of people say. So actually scrubbing something, a physical method, a manual process to clean and remove any visible organic materials. That could be things like poop, pee, vomit, snot, basically any organic material that's on that surface. Then after cleaning is when we have our disinfection. Sometimes these can happen simultaneously, but really it is a two-step process. So disinfection is actually inactivating pathogens that are microscopic. So those are things that we cannot see: bacteria, viruses, fungus, all of those things that are microscopic that are causing disease. Whenever we are applying disinfectant, then we are trying to inactivate those. Typically, are using chemicals to do that, and they need a certain amount of contact time to achieve that goal. And the contact time differs based on, again, the type of chemical we're using, concentrations, what we're trying to kill, and even what the surface is. So sanitation is considered the combination of those two actions. So cleaning and disinfection. We're eliminating as many infectious organisms as possible. So there are some general staffing recommendations out there that many of you are probably familiar with. These are widely cited by NACA and HSUS, and even the ASV guidelines talk about there's a considered minimum staffing needs to be able to properly clean and feed animals in your facility each day. And what that calculation looks like is we expect it to take 15 minutes per animal per day to meet those basic needs. This does not include additional things like, performing intake treatments, doing medical exams, doing enrichment, doing adoption counseling, all the other things that our staff members are probably tasked with doing. But just the basic cleaning and feeding and care for those animals, it takes 15 minutes per animal per day. So what this can help you with is when you're trying to look at, how many staff you need to have scheduled each day. And that could be, when we say staff, that could be paid and unpaid. You can also certainly include volunteer hours in this as well if they're helping with these basic tasks. So the other thing to consider is that really we would like to see animals spending the majority of their day in a clean environment. So it really shouldn't be taking your staff and volunteers the entire day, 8 or 10 hours to clean. Really, that should be happening hopefully at a chunk of time in the beginning of the day so that animals are spending the majority of their time in a clean space. So if you have, this is just for an example, if you had 300 animals at your facility and that was your daily population, then you would multiply 300 times 15 minutes per animal, which would give you 4,500 minutes. That's 4,500 minutes of staff or volunteer time. And you're going to divide that by 60 minutes per hour, which would give you 75 working man hours that you would need to be able to clean and feed those 300 animals. So if you wanted to accomplish that in the first 3 hours of the day, say everybody starts, at 7 a.m. and you open to the public at 10 a.m. So you need to have everything cleaned by 10 a.m. You would need 25 staff members required to meet that population of animals. And I think that seems like quite a high number to many people, but 300 animals might be what some of you guys are facing on a daily basis. So anyway, these calculations seem complicated, but can really help to put things in context for why our staff feel so overburdened, why we might be missing things, why we're rushing, because we might not have enough staff members or volunteers to adequately provide care for the number of animals we're asking them to care for. All right, so we'll start talking some about different choices for disinfectant, and I will certainly wrap up and let you know what my main recommendation is for a disinfectant that we use in the shelter. Clorox or bleach is one that many people are very familiar with, something we've used for a very long time because it is cheap. Something that is newer on the spectrum is accelerated hydrogen peroxide. It used to be called Excel and is now called Rescue. Trifectant and Virkon are another class of chemicals that some people are familiar with, especially if you worked in veterinary practice or especially like in cat facilities. This is a common one that's used because it is very conducive to being used in cages and those types of surfaces, as opposed to like kennel environments and larger spaces that need to be sanitized. And then we have a whole subset of disinfectants that we collectively call our quaternary ammoniums, or quats. So those are things like Rocal, Parvusol, Provet Logic, Kinosol. There's a whole lot of different ones out there on the market. We do not recommend the use of quats in shelters for a number of reasons, and I'll show you some examples of why. But I will say, just, a lot of people have this same experience and can speak to it, but anecdotally, when I started at our shelter about 6 years ago, we were using Kinosol there, and we definitely saw quite a bit of infectious disease, both in cats and dogs. We saw a lot of upper respiratory infection in our cats, as well as, we would see parvo pretty consistently in our dog and puppy populations. And since switching away from that quaternary ammonia compound that is not effective against those viruses, we no longer have those issues. So we have switched to Excel, which I'll show you kind of our system and how we use it, but definitely what we recommend. So and this is why. So we see a lot of tough bugs, or some pretty severe and serious infectious diseases in our shelters. And so we need to make sure that we're using a disinfectant that is effective against those. So the big things that we're worried about are these unenveloped viruses, parvovirus. So those affect both dogs and cats. So we talk about canine parvovirus, and we also have feline panleukopenia virus. So they're very, very similar. Feline calicivirus is a component of upper respiratory infections in cats, and then canine adenovirus, which is something that contributes to upper respiratory infections in dogs. So we do obviously vaccinate for all of those things, but like we've mentioned, this sanitizing and treating, being able to kill and inactivate these important, scary, potentially deadly viruses is a really important component. So unenveloped viruses, they lack this fatty envelope that goes around the virus, and that fatty envelope is what a lot of disinfectants target. So if they don't have that, then they're harder to kill, harder to inactivate. And then ringworm is in a whole sort of class of its own, because that is a fungus, and the fungal spores can be in the environment just like dust, and that is the infective form of the pathogen, and it can get onto the skin of cats, dogs, people, small mammals, pretty much anything, and can cause that fungal infection. So whenever you look at these kitties that are resting on this beautiful carpeted cat tree, it looks very cozy and comfortable for them. But we also have to keep in mind, can you disinfect that? That carpet material is very difficult to disinfect if it gets contaminated with one of these viruses or with ringworm or fungal spores. So we typically avoid things like carpeted cat trees in our shelter environment because they're very difficult to sanitize properly. This is a fantastic reference table. We won't go into super great detail with it, but I'm happy to email it to anyone. And the link is there as well. It's on the ASPCA Pro website, the Shelter Disinfectant Quick Reference Table. You can just Google that and pull it up. Basically, it looks at the most common disinfectants that we encounter and consider for shelter environments, and looks at, compares all these different qualities about them. So accelerated hydrogen peroxide is our recommended disinfectant there on the very left of the table, and it is effective against non-enveloped viruses. It's effective against ringworm. It's not inactivated by organic material. It's very stable. It doesn't even necessarily require to be rinsed off because it is very, very safe. And the contact time depends on the dilution. So again, I'm happy to send that to anybody that would like like a copy if you can't download it easily yourself. So a little bit more detail about each of those. So again, rescue or accelerated hydrogen peroxide is the disinfectant that we use at MAC, and certainly what I recommend for shelters that take in both dogs and cats from the community. It is an excellent disinfectant. It's very safe, and it is stable after it's diluted for about 90 days. So that means like once you make up a spray bottle of it, for example, it can sit on the shelf and is useful. Doesn't degrade in the bottle. So bleach is something, again, that many people are very familiar with. It is an excellent disinfectant, but it has no detergent properties. And so you have to clean your surfaces with a detergent first before you apply that bleach, because it's inactivated by any type of organic debris, like feces or vomit or snot. The vapors can be pretty irritating from bleach, as many people are familiar, and it can also damage clothing. Bleach is also, once it's been diluted and mixed, it's only good for about 24 hours. So you have to make it up fresh every day, and it also has to be protected from light. It degrades if it's left out and exposed to sunlight. The next disinfectant there on our list is Wissy Wash, and this I think has become less common, but it something that we used to see a lot in shelters. It is very similar to bleach. It's very similar to compound, and it's less corrosive and more effective than bleach. And it comes in these tablets that you put into this hose end applicator, and then you can spray that onto kennels, or even fill up spray bottles with the chemical to be able to use on other smaller surfaces. And then potassium peroxymonosulfate, so that is trifecta and Burcon. And those are excellent disinfectants as well. They're a little bit pricier and more complicated, or almost difficult or impossible to use in a big kennel environment, like with dog kennels. So we tend to see them sometimes, again, in veterinary facilities or with cats, or facilities that only deal with cats, where they're housed in smaller environments, like a cage that is only cleaned with a spray bottle, for example. But those are very effective against our unenveloped viruses. Okay, so quats, as I mentioned, these compounds, again, are effective against some things that we're concerned about, like distemper in dogs, Bordetella, the bacteria that contributes to kennel cough. They're effective against things like leukemia virus, FIV, the FIP virus in cats, and also most of the herpes viruses that we see in cats, because those are all, again, viruses that have an envelope. So that's what the compound targets. But they are repeatedly shown to be ineffective against our non-enveloped viruses, which are ones of major concern often from a disease spread standpoint in a kennel, because they're very hardy in the environment. So once our environment gets contaminated with parvo or panleuk, they can remain there, especially if you're not using a disinfectant that inactivates them. So quats are shown repeatedly, even though it's on the label, even though the name of one of them is Parvosol, which would make you think it killed parvo. These are ineffective against parvo, panleuk, a lot of our calicivirus, and adenovirus. Some other reasons to avoid quats are the toxicity piece. So especially for cats, these chemicals, if there's any residue at all, if they're left on surfaces and the cat comes in contact with that, or if it gets any of the aerosols from the spray bottle, for example, onto their fur, cats are fastidious groomers, so they're grooming themselves very often. They can develop really severe oral ulcerations from exposure to these compounds. It's a respiratory irritant, so can affect their respiratory tract, can actually cause pretty high fever. And so these cats will actually look like they have very severe upper respiratory infection. And you might even look in their mouth and you see this oral ulcer and you think, oh no, this is a horrible form of calicivirus. The cats are incredibly painful. They're not eating. I mean, it is very severe sometimes, and it's simply a toxicity from the cleaning chemical, the quaternary ammonium compound. The other thing that we've sometimes seen is in dogs, especially if they can actually develop skin irritation, particularly burns on their scrotal area, just on their paw pads from exposure to these compounds in their kennel environment. So a lot of reasons that we don't recommend quaternary ammonium compounds in the shelter. As I mentioned, I definitely recommend rescue or accelerated hydrogen peroxide. And this is our little setup at the shelter. I just kind of wanted to illustrate it. We actually order them in these large drums, those blue drums. They come on a pallet, I think of 4 drums, and that lasts us for a significant amount of time. And then we have this wall-mounted sort of 3-way ball valve unit that dilutes the Excel to different concentrations for us. And so that's how we fill up our spray bottles to be able to use on surfaces and like our cat kennels and everything. And then we put the Excel directly into the hose end foamers that we attach to our hoses in our kennels for spraying down the floors and the dog kennels. So it's important to remember too, it's not, there's a couple of other things to keep in mind, that it's not just about choosing a specific product. So once you've made a decision and hopefully you're going to use rescue in your shelter, you also need to be paying attention to the fact that you're using the correct dilution and that you're observing the correct contact time. Also thinking about the application method of how we're applying this disinfectant to all the surfaces that need to be cleaned. And then another kind of key piece is using dedicated equipment. And this helps with biosecurity so that we're not, taking squeegees throughout the building, or, having to go in search of a hose end foamer, for example, or stealing the squirt bottle from one area to go use in a different area. So we actually, a long time ago, implemented a system where everything is labeled in our shelter. We just have different colors of like duct tape that mark each spray bottle, for example, for which part of the shelter it belongs in. And that helps us to make sure that something from an isolation room doesn't accidentally migrate out and end up in an intake room, for example. So having dedicated equipment is very helpful. These indicator strips are something that you can get pretty easily from your distributor, and that will help you to make sure that you're using the correct dilution of accelerated hydrogen peroxide, or the rescue. So, it's not the cheapest disinfectant, and so you certainly don't want to overuse it. Basically, you want to make sure you're diluting it enough that you are being cost effective with your product, and you're not using so much of it that you're basically wasting money. And also that you're using enough that it is going to be effective. And again, as we mentioned, the contact time depends on the dilution of Excel that you're using. So depending on your facility and your staffing, and just what your flow is like, hopefully you can observe a 10-minute contact time, because then you can use less of the disinfectant. You can use a lower dilution on a 10-minute contact time. If you need it to be a 5-minute contact time, if you're not able to let it sit that long, as you're moving through the sanitation process, then you're going to need to use a higher concentration. So I wanted to briefly touch on spot cleaning. Hopefully this is a familiar concept for most people as well, but this is something that, again, we've learned kind of over the past 10 years is really a best practice, especially for cats, but it can be used for dogs as well. But spot cleaning, historically we kind of thought, oh, we should take the cat out of the cage, deep clean their cage every single day, completely spray it out with disinfectant, wipe it clean, give them fresh new bedding, fresh newspaper, fresh litter box, fresh food and water, and then put the cat back in the cage. And what we've realized, is that actually that is super, super stressful for our cats and directly contributes to them developing upper respiratory infection in our shelter. So if you are seeing a high rate of upper respiratory infections in your cats, where they come into the shelter healthy and then they develop these signs after they've been at the shelter for a few days to a week, something to really look at and follow up on is monitor and observe how your staff are cleaning in those cat areas. And it involves cleaning in both the intake or the quarantine areas, basically, the places where the cats are housed when they first get to the shelter, as well as in your adoption floor. Spot cleaning has been shown to be effective and much safer for our cats. It keeps them healthier, and it also may not take as long for your staff. So you're more efficient and resourceful with your time, and you're using less disinfectant as well. So that is better cost savings for you. There are some great videos on ASPCA Pro, as well as plenty of examples of written protocols for spot cleaning. And I'm happy to share ours as well that we have at our shelter if you want to email me. But basically, the gist of it is that we don't take the cat out of the cage. We basically take a quick look at their cage. We want all of their germs and their smell, their scent to stay with them in their cage. So that cat is usually gone around the cage and scent rubbed and facial marked everywhere to make it feel like home. So it smells familiar to them. So we want to leave all those smells with them. So we don't spray any sort of chemicals anywhere near the cat or in the cage at all. We don't move the cat. We just refresh their food and water and their litter box, and maybe change the bedding if it's soiled. But if there's just a little bit of cat hair on it, we leave all of that with them because it smells like them. It's very comforting to them, and it keeps them less stressed and healthier. This is actually what our housing looks like for our cats. Double-sided housing is the way to go for cats if possible. So there's lots of different options. Either you can buy housing that is created already in this way, where they have a portal that allows them to move from side to side, or you can sort of rehab your existing cat cages and you can cut holes in between and add a portal so that the cat can move from side to side. And the benefit of this double-sided housing is that you can block the cat on one side during that daily cleaning, especially if they're super friendly and they're trying to rub all over your arms while you're changing out their litter box, for example. So you can just block them on one side, tidy up the cage, and then let them move to the other side while you refresh, the litter or the food and water on that side. The other nice thing about the design of these cages is that it allows you to really separate their food from their litter, which helps relieve their stress. Cats don't want to eat in the toilet. And then also, it gives you room to be able to give them a hiding place if you need. All cats need a place to hide, and there's a lot of different options for what you can provide for them. We use these handy little feral dens is what they're called, but they're like little transport carriers. So the cat basically goes into that transport carrier right at intake. It has a nice thick towel in it, so that's their bedding, and that stays with them throughout their entire shelter stay. So they can go be transported, carried through the shelter in that little feral den whenever they go to have their vet exam or go to have spay neuter surgery. And then when they move to the adoption floor, all of that bedding that's in that cage goes with them. So it all smells very familiar to them. So we mentioned do not spray disinfectant near the cat. We sometimes see this happening where, again, this is a version of spot cleaning. We haven't taken the cat out of the cage, which is great, but we absolutely don't want to be spraying chemicals in there with the cat present. So if you need to clean something in the cage, you always want to spray a cloth or a rag or a paper towel outside the cage, and then use that moist rag to be able to clean the surface in the kennel. Deep cleaning is definitely still required before a new cat enters the cage. And if you don't have double compartment housing, then another sort of trick or way to circumvent that is just to put those, especially kittens, for example, if they're really bouncy and active, that you can confine them to a carrier while you're cleaning their cage. And then you can put them right back into that same cage. Of course, if you do that, then that carrier either needs to stay with those kittens and just be marked that that's their spot where they hang out whenever you're cleaning each day, or it has got to be disinfected before other unrelated cats or kittens go into that carrier.
Hey, Dr. Cannon, we have a question.
Okay, sure.
One question is, I love those kennels. However, I do have a question. If you have a fearful cat that hides all of the time, how do they get adopted? Do you remove it and replace with a bed so they can be seen?
So we encounter that a lot as well at the shelter. So what we really follow is what Fear-Free Shelters promotes, is that every cat needs a place to hide. So if they're hiding, that is what they're doing to try to basically cope with the stress of being in the shelter environment. And if we take away their ability to hide just so that they can be visible to an adopter, we are causing quite a bit of fear and anxiety and stress for that cat. And that's not really a humane way to house them. So we just try to look for other ways to help them feel more comfortable and come out of their shell, and be available and visible to adopters. So we have volunteers that work with them, our staff members that work with them. We do a lot with like treats and really tasty canned food, for example, trying to help them have a positive association with people. And some of those really fearful cats we also send to foster homes, because that way we can learn a lot more about them and market them for adoption without stressing them. We have a couple of rooms at our shelter that are, we can place a cat that maybe doesn't do well in a kennel, so that they can feel more confident, basically, and people can approach them in the room. So it's a little bit like a, cage-free housing, but communal housing for the cat. But we really try very hard not to prohibit them from hiding if that's what they need to feel comfortable. You can also talk with your veterinarian about using some anti-anxiety medication for cats. We're starting to do that as well, just to help them acclimate and feel less stressed in the shelter environment. And that can sometimes cause them to really come out of their shell more quickly and be available and visible to adopters. It's a really good question, and something that I know everybody struggles with our shy cats. So thinking about all the different surfaces that we need to sanitize, we've talked a little bit so far about housing, obviously, because that's a clear one to sanitize areas where cats and dogs are being housed in the shelter. But we have to think about all the other places that they might touch throughout their stay or throughout even just their processing. So we think about all of our common use areas, like our intake rooms and like the scale that the dog steps onto to get its body weight whenever they first come in, if they're walking up and down hallways, any kind of handling equipment that we might use. So leashes, muzzles, certainly if you're using any control poles for dogs, those need to be sanitized. Our food and water bowls, litter pans, any of our kind of transport equipment like carriers or those feral dens that we use for cats, if we're using traps or nets. The entire animal control vehicle, like our truck or our van, we have to obviously think about sanitizing those and have a set protocol and checklist for making sure that that happens, because often, we're seeing very naive animals that haven't been vaccinated yet that are getting on an animal control truck, for example. Thinking about laundry and bedding, the housing, as we mentioned, and then of course our hands and our clothing as well can be fomites. And so we've got to sort of keep that in mind about making sure that we are aware that we are serving as a fomite and spreading infectious disease possibly on our hands or our clothing, and also how to mitigate that. So one thing that we do is recommend that our staff change their clothes, their scrubs, for example, after cleaning and before they start the rest of their day, especially our staff that are handling brand new animals and doing intakes, for example. And then observe our required contact times. So this is just a little pro tip, something that we all are probably familiar with being in Tennessee, is that we see canine distemper in our wildlife. So raccoons are the most common one I think that we hear about, but certainly there's reservoir species with our wild canids as well that are affected by canine distemper virus. And so that's the same virus that is going to affect our dogs and ferrets if you have ferrets in your shelter. And we see this kind of cyclically in Tennessee, it seems like, where every few years we see a big spike and there's an outbreak in raccoons, for example, and then that can spill over into our domestic dogs in our community if they're not vaccinated. So the vaccine for canine distemper is very effective. And obviously most people, their dog has ever been to a vet, it's gotten a vaccine. And it gets boosted, every year, every 3 years, depending on your veterinarian. But if your puppy or dog out in the community has not been vaccinated and they get exposed, to a sick raccoon, for example, it's a prime time that they're going to become infected, and then they can bring it into your shelter. This is something that challenges a lot of shelters, and especially your relationships with transport partners, because canine distemper is something that has a long incubation period. So sometimes the dogs don't show any signs while they're in the shelter, and then they might go on transport and get sent out of state, and then they end up with distemper at the destination, and that can really maybe be a hindrance to your relationship with that destination shelter in the future. So thinking about this from the very beginning, something that we are really careful of with our shelter is making sure that we don't transport sick wildlife on the truck with dogs. And if we do have to put sick wildlife on the truck, then we are obviously going to disinfect that before we load a dog or a puppy into the vehicle afterwards. A few years ago, I think it was 2019, we saw probably like a 10-fold increase in our call volume for sick wildlife, and just saw a big spike in distemper cases in Nashville. And it can be devastating, obviously, for your shelter, for doctors, fosters, and like I said, your partners, your transport partners. So we want to avoid putting dogs and wildlife on the truck together to share that airspace. Again, canine distemper is really easy to kill with adequate sanitation. It is not a hardy virus, but if they are sharing airspace and it's very easy aerosolized, if they're nose to nose and breathing the same air, then it is easily transmitted. Another thing that I recommend that we say no to is foot baths. So this is something that sometimes seems like a good idea. You think like, oh, I'm worried about my shoes and tracking infectious disease on my shoes or my boots. And so you want to put something like a foot bath outside of like your isolation ward, for example. But when you think about it, it's all the same sort of challenges that we've talked about for other surfaces, right? So there needs to be adequate contact time to be able to inactivate some of these serious infections like parvo. So unless you're going to be able to stand in the foot bath for 10 minutes, you're not really going to achieve adequate contact time for that disinfectant to do its job. They're also pretty easily contaminated, especially if you're putting something like bleach in your foot bath, right? So we talked about how bleach is just immediately inactivated by organic debris. So if you're stepping into a foot bath and you've got any kind of dirt or fecal material on your shoes, that's just going to inactivate that disinfectant. Bleach as well, like we've mentioned, is inactivated by light and has to be made up fresh every day. So it's just an extremely poor choice for a foot bath. We also need to be doing some mechanical scrubbing. We talked about that. So that's the cleaning part, the cleaning half of our sanitation process. So you would need to be scrubbing your shoes with a bristle brush, for example. So a better option is just to use dedicated boots in isolation facilities. So you can take those off and leave them there. Or use something like a disposable shoe cover. So the order of cleaning, this is something to consider when you're making your cleaning protocol in your facility. We want to clean from order of susceptibility. So susceptibility of disease and potential risk. And we start with the most susceptible animals and we end with those who carry the highest risk of transmitting infectious disease. So that means that your staff is going to clean your healthy and adoptable puppies and kittens first, and then your healthy adoptable adults. And they move on to like your stray intakes. And then finally, they go to the quarantine rooms and clean isolation rooms last. And then ideally, they would change clothes before they go on to handle healthy animals again. Sometimes you might have enough staff that you divide up and everybody is cleaning different areas, which is great as well. So how about sanitizing all of these potential fomites, right? So like dishes, food and water bowls, toys, litter pans. These are all things that come into contact with our animals and can potentially be contaminated with parvovirus, for example. So when I look at this, rolling cart here with dirty food bowls and Kongs and litter pans, these are all things that are potentially infected with parvo. And so we are lucky that we have an industrial dishwasher machine that we can use to sanitize all of our bowls and litter pans. Not everybody has that. The important thing to keep in mind is that you need to clean your bowls and items that touch the animal's mouth, clean those separately from litter pans. So things that have touched, fecal material. So that's why we have them separated on our cart there as well. And then they go into the dishwasher in separate loads. If you don't have a fancy dishwasher, or if your dishwasher breaks, which ours does from time to time, then you can also use something like this, which is the triple basin technique. So the bowls need to be sanitized separately from the litter pans. You would use the first sink with water and soap for mechanical cleaning. Then you would rinse with water. And then the third sink, you would have your water and bleach or your Excel, something with a disinfectant property. Observe your adequate contact time, and then you would rinse and air dry. Our laundry basics, there's a few key things to keep in mind. We want to shake off any large debris before washing. So you can dump any large, pieces of fecal material into the trash before loading the laundry into the washing machine. Really important not to overload our washer and dryer. So the key to being able to properly decontaminate laundry is to just ensure adequate agitation. So that means it can't be stuffed full. There has to be room for the fabric and everything to move around inside the washer with the water and the detergent. Another important step is using heat to dry. So putting it into an industrial or mechanical dryer. If you air dry, then sunlight is really, really important, but it is ideal to be using an actual dryer with high heat. And then you can add bleach to hot or cold water in the washer. It doesn't matter which, it's not inactivated by hot water. So something just to keep in mind. We also want to think about our hands and our hand hygiene. So a lot of different options here. We want to always remember to wash our hands with soap and water when they're visibly dirty. If they've had contact with any bodily fluids, anytime after you take off gloves, you're going to wash your hands. And then it's important to dry them as well. So if you leave your hands, if you leave all that water on your hands, then that can be sort of a breeding ground again for bacteria can persist. So we want to thoroughly dry them with paper towels. We want to wear gloves when we're handling infectious animals. We know we're going to have contact with bodily fluids. Anytime you're handling disinfectants, because that helps protect you. And then again, washing our hands after we take off gloves. And then hand sanitizers can play an important role as well. They need to be at least 60 to 80% alcohol based. They only are going to work on clean hands that you don't see, organic debris on. And just having them available tends to improve compliance with keeping our hands clean. So hand sanitizers that are alcohol based are not going to be effective against things like parvovirus, but it is certainly better than nothing. So having our hand sanitizers available is helpful. And then outdoor areas at the shelter, many people have this, especially if you care for dogs. It's important to keep in mind and have your staff and volunteers remove any solid waste promptly. So that is going to prevent, the environment from getting contaminated with parasite eggs or even some of our viruses if we're removing the fecal material quickly. You can also use a disinfectant that is not inactivated by organic material. So that would be something again like Rescue, the accelerated hydrogen peroxide. We actually have a yard that's made with AstroTurf, and you can spray Rescue onto the AstroTurf. Maximizing sunlight exposure is another key thing that can help to limit infectious disease in your outdoor areas. But kind of the key as well is just to think about the animals and the dogs that have access to those areas and restrict access to our vaccinated and dewormed and healthy adults. So we don't put puppies that are under 6 months of age out onto the ground. It's just too much of a risk that they could be either shedding something or that they could pick up something that's already there. So we, if we're going to have dogs in playgroup, for example, they are vaccinated, they're dewormed, they appear healthy, and they are over 6 months of age. So taking into mind all of these different key components, you will want to establish a written protocol at your shelter and include a variety of information, because this is kind of a key for training new staff and also just making sure that everybody sort of stays on the same page and things don't change over time. So you would include in your written protocol a schedule of sanitation, how often different areas are cleaned, and what might trigger, a need for a specific sanitation protocol there. For example, if you diagnose a case of ringworm or parvo, how is it going to be sanitized differently? What supplies are needed? And then just going step by step of exactly what is done. We actually, even using training videos can be really helpful for people as well. So having it in written form, but then also creating a training protocol for your specific shelter and all of the nuance that is there is really helpful. All right. Do I have 2 minutes to do this very quick case study? Hopefully. I think this is pretty quick. So I was going to briefly talk about something that we have certainly experienced in our shelter, and I'm sure many of you, this is going to seem familiar. It makes us all cringe, especially in the summertime during kitten season. So we bring in a litter of 4-week-old kittens into the shelter, and they go out to foster care because they're too small for adoption, right? And they need to gain weight and get bigger. So they go out to a foster home, and 3 days into their foster stay, the foster sends an email and and a photo, and they've noticed some hair loss on the face and the toes. And they come back to the shelter, they stop by and see your veterinarian, and you confirm that they appear to have a ringworm infection. So maybe they're woods lamp positive, they're glowing on the woods lamp exam. And then you also are going to take a culture sample to confirm your diagnosis. But now you're looking at a contaminated shelter environment for where those kittens were when they first arrived at the shelter, but also the foster home is now contaminated. So whenever we think about next steps in this type of situation, certainly we want to treat the kittens. We want to deal with the ringworm infection. Again, ringworm is a fungal disease. It's a fungal infection, can affect kittens, puppies, dogs, cats, small mammals, and people. So it's zoonotic, and that is our big concern, certainly with making sure it doesn't spread to others, as well as thinking about the environment. So those fungal spores are very hardy in the environment. And, ideally, whenever we have fosters, we hope and explain repeatedly why we want them to keep those kittens isolated to an area that's easy to disinfect. But we know so often that's something that just kind of goes by the wayside when people get these adorable kittens home and they let them run all through their house and sleep in their bed and all the things, right? So then we have to think about how to decontaminate all of those areas. So we're going to treat the kittens. Ringworm we treat both topically and systemically. For us, at least at our shelter, we do lime sulfur dips twice a week, or we do antifungal shampoo and do medicated baths, like something with iconazole in the shampoo. We do those twice a week. And then we also treat them systemically, especially once they're big enough. We do oral terbinafine daily. And that is very, very effective at getting rid of ringworm and preventing continued shed into the environment. But we have to recognize that they've already contaminated the environment. So how are we going to take care of that? So there's all the surfaces that they may have touched, as well as what to do with the laundry and bedding. So whenever we look at the hard surfaces, again, we're going to do a combination of cleaning and disinfection. So mechanically removing all the debris, including any cat hair and spores. These fungal spores are just like dust. They can settle on surfaces. So we use a lot of elbow grease and we just remove all of that. And then we're going to wash all these surfaces with detergent until they're visibly clean and rinse that. Those are the most important things. We used to think that we had to spray everything down with this super concentrated, very high amount of bleach. We were taught a 1 to 10 dilution of bleach, which is extremely irritating to your airway. It's very hard to even be in the same area as that, especially indoors. So luckily, we've had a lot of research in the past few years from Karen Moriello, who's a veterinary dermatologist in Wisconsin, and just extremely knowledgeable about ringworm. And she has shown us that we don't have to use that ridiculous concentration of bleach. We can actually use a variety of different disinfectants that are labeled against trichophyton, which is one of the types of fungus that causes ringworm. But the most important part about using those disinfectants is that you have to apply them to a clean surface. So you've already washed it with a detergent and removed all the, again, hairs, spores, dust, dirt, any organic debris. And then you let it sit for its contact time of 10 minutes. So spot cleaning, just like we do in the shelter, can also be very helpful in the foster home. Again, it's less stressful. We have reduced transmission of fomites. It's safer for the animals and the people, and we have less use of our very irritating disinfectants for their airway. But once that foster home is vacated, just like that cage of the shelter, you're going to thoroughly sanitize that environment. All right, and then ringworm laundry. So this is something that people, I think, are often concerned about. Certainly, we typically separate our ringworm exposed laundry from our normal laundry, if we know, and we are going to wash it in our mechanical washing machine, and we're going to dry it on high heat. And the most important thing, again, is not to overload the washer. We want maximal agitation of all those fabrics. Doesn't matter what temperature of water you use. In one study that Dr. Moriello did, she showed complete removal of all ringworm spores after 2 wash cycles that were 14 minutes or longer. And it didn't matter if she put bleach or not into the wash cycle. So again, most important is just to wash it in a washing machine that is not overly stuffed. So looking at all these pieces of the foster home biosecurity, we want to keep kittens in a designated area. Think about PPE for our foster parents if they are dealing with ringworms. So that's things like gloves and maybe specified clothing like a disposable gown or scrub top that they would use when caring for those kittens, using plastic toys because they're easy to disinfect, making sure they're providing appropriate socialization to these kittens, removing the hair daily and cleaning daily with spot cleaning, and then twice weekly sanitizing. We do that at the same time that we do their lime sulfur dips or their Malicid baths. So we're disinfecting the kitten, basically. We're removing all the spores from the kitten. And at the same time, we disinfect their bathroom that they're living in, and we wash all of their bedding to give them fresh, clean bedding. Okay, so we mostly focused on sanitation for this talk. But again, our other disease prevention strategies in our shelter environment are to vaccinate on intake, make sure we're using appropriate housing, and minimize our length of stay. Just want to do another plug for Dr. Carson's talk tomorrow, where she's talking about the importance of length of stay in the shelter, because we're going to be able to prevent crowding, which is the most important thing to prevent disease. This is just a list of websites that I definitely encourage and textbooks that are great resources to have on hand. ASV, the Association of Shelter Veterinarians, has their guidelines for standards of care in animal shelters, and there's a checklist version of this that can be really helpful to go through with your facility and see what changes you might want to prioritize. And that is my email address. In case anybody has any questions at all or wants examples or copies of protocols, I'm happy to share anything with you guys. Okay, sorry, Laura.
Thank you, Dr. Cannon. That was awesome. We had that one question regarding the cat kennels. Everyone's just saying thank you. And again, Dr. Cannon put her email up there if you need anything from her. If not, we will see you guys in 4 minutes to our membership meeting. All right. Have fun going to the bathroom. Bye.